um, have to exit, but we do keep things private. So with no further ado, I'm really excited to introduce Dr. Mike Alden. Dr. Alden is a functional neurologist, a chiropractor who specializes in blood, metabolic disorders, nutritional therapy, and things like that. And I met Mike through another colleague when I was down in South Carolina last spring. And I think, as everybody knows here, I really believe in having chiropractic care when head injuries, because that was the therapy that actually helped my daughter with her severe chronic dry eye. And so I'm a big advocate of whole health healing and things like that as well. So that's how we met. And then when I got to chat more with Dr. Alden and I discovered he was using this lab test, we got talking more. We talked about how I was very sick, and the lab work, the blood work that a naturopath did for me got me better from my mold poisoning. And one thing led to another. The folks that he works with are from my alma mater out at Loma Linda Med School. And so that's how we became connected. He then was excited about Sally and his patients, and he dove into the whole concussion protocol testing because his knowledge in functional nutritional therapy to actually support the body from the bottom, from the inside out, is what was driving him and his excitement to pull this forward into concussion and traumatic brain injury management and care. And I think it kind of even extends into more all brain injuries, right? I mean, there's a lot to be said. So please don't think it's narrowly focused on only head injuries, TBIs, and concussions. He can speak about everything. And I actually even sent him some questions from a stroke patient that I got to meet last week. With no further ado, I shall let Dr. Alden take it away.
Well, thank you very much, Lynn. And I appreciate that introduction. That was a pretty amazing guy you're talking about there. I don't know if I know him or not, but thank you. As Lynn said, I've been working in, I started out as a chiropractor in '94 when I graduated Palmer College. And in around 2010, I was introduced to functional medicine, believe it or not, before I even knew what it was called. I started learning about it. And by 2013, I actually started practicing it. And in roughly 2015, 2016 is when I was introduced to the blood-brain barrier test developed by Dr. Bajdani at Cyrex Labs. Kind of a real quick historical rendition of how I got into the concussion world. Through my work with Cyrex prior to 2015, 2016, I'd gotten kind of comfortable with neurometabolic disorders and autoimmune physiology, and that actually kind of became my forte. I also work exclusively with Dr. Datis Karazian. So if you know those two names, you know how impressive they are to the entire functional medicine world. And it's really my honor and privilege to be mentored by both of them. Speaking specifically since 2016, when I really started moving forward with neurometabolic issues based on what I was learning through the blood-brain barrier permeability test as it was released by Dr. Bajdani, that's kind of where I launched into brain injuries and the following post-concussion syndromes and those kinds of things that lead to neurodegeneration, neuroautoimmunity. So it's kind of a relationship between all of those issues that follow that initial injury or concussion, and that's kind of the history behind how I got to where I am today. I've been very fortunate because once I was aligned with Cyrex, which of course again started in 2010, but by 2016 my full alignment with the blood-brain barrier testing and the other neurological antigens, antibodies that you can find when you've got neurodegeneration, was put together in such a way where we designed Atlas Concussion Testing, the company, with that as our centerpiece. So everything else sprang from within that. And that's kind of where I could begin today to talk to you about how once this blood-brain barrier permeability test was implementable, I was able to utilize it in a way so much more different than anything else in the history of TBI treatment and testing could ever have been done. First of all, I think if we flip to the next slide, Lynn, we'll be able to get to, this is, by the way, everybody, this document that's up here, it's the brain reactive antibodies and traumatic brain injury by Dr. Vojdani. That is probably my most important piece of research documentation. And I will be more than happy to share that with anybody on here. It's kind of my lead article that I share with everybody. It is phenomenal. And just a few pages, it's not very long, but it is the publication that justifies, validates, verifies everything of the blood-brain barrier permeability test from its inception. Now, this obviously was published in 2013, and the test didn't come out till 2015, after which it was patented by Dr. Vojdani and Cyrex Labs. It's a great article that describes in detail the science behind the how and why the blood-brain barrier is so important, how it functions, what happens when it gets broken down. And I think if we flip to the next slide, I'll have a picture that I can show you guys. There it is. This artist rendition of the blood-brain barrier, it makes it a lot easier for me to show you this than use my hands to show you how things get broken down whenever there's an injury. One of the concepts that I like to teach my patients and my audiences is the fact that the concussion itself is a biomechanical insult to the blood-brain barrier. It starts with that impact, okay? The problem is, once that impact has been received by the head, a lot of things happen inside the brain. And that blood-brain barrier disruption that is illustrated on this picture is the physical insult to the barrier. Now, what's happening below, if you can drop that down into there, you'll see there's a lot of evidence of chemical release, and that's the biochemical portion of what happens after the original concussion, and that's what lingers. That's where symptoms come from. All of those things you see there are parts of that brain milieu that support the blood-brain barrier, the astrocytic foot end feet, the microglial cells, which are the immune cells of the brain. They're out there patrolling, trying to protect the brain. So if I can get a little bit scientific on you, as those microglia are in their resting state, they're just kind of waiting for things to come into the area that aren't supposed to be there. Once they enter through those broken down barrier tight junctions that you can see in the picture, you will notice they're like little specks being released from the microglia. That would indicate chemokines and cytokines, brain autoreactive chemicals that upregulate the immune reaction to try to destroy whatever is not supposed to be there. When those blood-brain barrier connections are there, then they're keeping all of the molecules that are larger than 400 Daltons out of the brain milieu, and that keeps everybody happy. But once there's a disruption, once there's damage, and molecules come in, whether they're good for you or bad for you, or in any way different than what's supposed to be in there, these microglial cells start damaging everything in sight, including the astrocytes. Once the astrocytes have been destroyed, then we're looking at a release of something called S100B. Just a quick side note, S100B has been studied by scientists for some time as far as an early release biomarker for concussions, and it would be a really helpful way to identify when the concussion has been received or exists. The problem with S100B in its original state is its half-life is only 4 hours. So within 24 hours, you can't measure that anymore. Now, I'm going to take you a little bit further into the blood-brain barrier permeability test and tell you that when we are studying the biomarkers, we're not studying the S100B in its original state. We're studying the antibodies that are created against S100B, which are much more stable, can last for weeks to months, and sometimes even years in some people if the blood-brain barrier remains disrupted. Along with this whole pathway, right on down to the very bottom of the page, you'll see there is something called immunoexcitotoxicity. And that's break that word down, the immune system becomes excited and it becomes toxic to the brain and brain tissues. So once these support tissues are being destroyed, disrupted, or degenerated by the immune system, now we would see ongoing symptoms related to the concussion or the post-concussion syndrome, things like brain fog, light sensitivity, stomach or gut brain axis issues, things like that. So a lot of times when you talk with somebody who's got the symptoms, which are important to everyone involved, except maybe me, I'm more interested in what's causing those symptoms. And that's what I share with my patients all the time. You know, if you have a headache, you can take an aspirin and maybe the headache will go away, but I want to find out why that headache is there. That's what essentially for me, functional medicine is all about. And so if I can eradicate the cause with my treatment interventions, then I should, in essence, be able to remove those symptoms and strengthen the whole system from there. That's kind of the scientific explanation for the blood-brain barrier disruption. Now, the permeability test tells us when the blood-brain barrier is disrupted, and if you haven't figured out by now, once the blood-brain barrier is healed, we can also do a follow-up test, and that will also show the downregulation of those antibodies, which completely will tell you objectively that the blood-brain barrier is healed and it is truly safe to return to play. In my estimation, all these years I've been doing this since 2016, I've not found any other biomarker, and I've looked, whether it's neurocognitive testing, whether it's restoration of balance and gait, no matter what it is, there's nothing objective as stout and perfect as the post-test for the blood-brain barrier permeability test. It tells us that the brain is healed and it's safe to return. Now, one kind of neat side note is if that same athlete goes back into play after the blood-brain barrier has been healed and they receive another concussion, it would be another first concussion rather than a second impact syndrome type concussion. It won't be the third or fourth or fifth on top of that original concussion. Now, why is that important? I will tell you, because once the concussion has occurred and the blood-brain barrier is disrupted, if the barrier is not allowed to heal and those microglial cells are upregulated and they're fighting all things that are coming through, another concussion, a follow-up, whether it's hours later, days later, or whenever later, will reactivate those microglial cells or actually activate them even more so than they were originally, which will cause an even more intense release of those chemokines and cytokines. If you've ever wondered where does CTE or chronic traumatic encephalopathy come from, this is exactly it. So all those football players in the NFL who are suffering from CTE, all the UFC athletes, all the people in any kind of professional or amateur sports who are suffering from the post-concussion syndrome leading into the really devastating CTE, they always say it comes from concussion. And this is exactly why. When those chemicals have been released and they aren't down-regulated, the immune system then has an opportunity to create antibodies against the antigens from the tissues that have been broken down. There's a free flow back and forth between that barrier, which will promote that neuroautoimmunity. Neuroautoimmunity, neurodegeneration, we're talking things like MS, ALS, Alzheimer's, Parkinson's, senile dementia. Those are all the diagnoses of these brain disorders that can be related directly all the way back to that concussion or that opening of the blood-brain barrier. And remember, it doesn't just happen to athletes. People in car accidents, people falling off of ladders, people bumping their heads in different ways, shapes, or forms. Even things like blood-brain barrier that's been disrupted by an infection or a chemical sensitivity. There can be a number of things that can disrupt the blood-brain barrier, but if I want to focus just today on concussion, it's an easy one to understand. Hit your head, open the blood-brain barrier, start allowing these chemicals to go back and forth between the barrier, and then ultimately what we find is the creation of the antibodies. Now, there are also other tests that are provided through Cyrex Labs that I utilize that look at specific neurological tissues and neurological support tissues, things like myelin basic protein. If you're familiar with the myelin basic protein, you'll know that it makes myelin sheath that wraps around all the neurons. If the myelin basic protein is being attacked, that means myelin sheath is being disrupted or destroyed, and that's a demyelinating condition. You're looking at MS. The beauty of the Cyrex Labs testing developed by Dr. Vajdani is if I find antibodies with the blood testing, not the blood-brain barrier test, but the follow-up testing, if I find myelin basic protein antibodies, I'm surely going to know that down the road, not very far from then, will be the evidence of MS or other demyelinating conditions. The cool thing about what Dr. Vajdani's designed is these tests are so sensitive, they're predictive in nature 10 to 15 years before enough white matter will be detected on an MRI to show you that that person has myelin disruption. In other words, MS can be headed off with these predictive antibodies. You can start initiating strategies to stop it from progressing. I know I'm getting kind of deep into that scientific background of the blood test, but I am totally enamored what I can find out from these tests. We can slide to the next test, and I can kind of elaborate a little bit about the test itself, which of course is going to tell me that we've got a disruption of the blood-brain barrier. But many times when I'm speaking about what's happened from that barrier disruption, I usually get the athlete or the family or the patient in front of me who kind of glazes over, and I know what their next question is. They've heard enough and they want to know if there's treatment. And yes, the good news is there is treatment in our protocol to help close the blood-brain barrier, to down-regulate the inflammation, and to stifle the immune reaction against those tissues. And that's kind of the other side of the coin there. So the concussion management can go well beyond just looking at the blood test to tell people how badly they're injured. If you'll flip to the next one, Lynn, I can show you guys a kind of a picture of what these blood test results look like, and they're really, really, really easy to read. You'll notice that the barrier proteins that we're studying are IgG plus IgA and IgM. They're separated because the IgM is a recent damage or recent insult. Those are the first, oh gosh, after 7 days up to 21 days, we can detect IgM antibodies against the blood-brain barrier. Anything beyond about 21, 28 days, and this could last, as I said, for months, I'll find evidence of IgG plus IgA. Well, if you look real closely at those three samples I put up there, the one on top is a completely functional blood-brain barrier. That's a good one. That's what everybody wants to see pre-injury, and definitely when I'm treating, that's the one I want to get back to. The second one down shows recent damage. Remember I said IgM is the recent indicator. And then the last one would be ongoing damage. Again, after about 28 days to months and sometimes years, I'll find this persistent open blood-brain barrier, and that's that IgG plus IgA. That's also going to tell me that we have evidence of ongoing tissue destruction. So that's exactly when I'll start running the other blood tests to look for the 5 support tissues that we measure for post-concussion. I can relate that to early CTE, things like that. And I like your pointer, Lynn. That's it's so simple. It's just one test tube. That's it. It's very simple. It's a serum biomarker. So basically here in my office, we draw the tube, we spin it down, I pour off the serum, and I mail it to Cyrex Labs in Phoenix. Within a few days, they've got it. They start processing it. And usually in a couple of weeks, I'm trying to push them to make them come back faster, but within a couple of weeks, I've got the results. In that couple of weeks period of time, I can initiate treatment. I don't need the biomarkers to tell me to start treatment because it's evidenced by the other tests that I utilize. I've got other baseline testing that I have in place that are not blood test related. I use SportGate for gait testing, for balance issues with bombs, with eye movements. They've got a wonderful neurocognitive test that I use. So a lot of these are excellent baselines that can go along with my blood test. So anybody who's a little squeamish about having their blood drawn, I'm really happy to go through the SportGate protocols with them. That also enables me to know that we've got symptoms. We've got, well, gosh, Lynn's got the symptoms covered. So whenever my patients are utilizing that program, they're able to keep me abreast of what's going on with them symptomatology wise. But the other testing and treatment through SportGate is real helpful there. The treatment is, and you can go ahead and flip up to the next one, Lynn, if you don't mind. That's fine.
This
One of
one
the things
says
that,
problem, Mike. Is there a different slide that you wanted me to go to?
no, you can go to this one. It's fine. It's fine. This it's the problem slide basically is dedicated to the fact that concussion management is, I think it's underserved. I think it's sorely underserved. And there are a couple reasons why, because, and I'll tell you one in particular, CT scans. Everybody's looking for a CT scan right after a concussion. And essentially the research shows that CTs are helpful for only about 10% of identifying concussions, whereas the blood-brain barrier S100B testing is way, way, way more specific to the concussion. So when you're so far behind, when you're just using CTs to identify the issue, you're going to miss a lot of concussions. You're going to not have a true objective finding, and you're going to rely a lot on subjectivity. That's where I consider to be the problem. So when we see biomarkers coming out that are inarguable, like the blood test, then I would prefer to see some of that being more utilized in all sports and in basically in all healthcare.
Let me move you down a little bit, Mike, because we're at 3:22.
Oh goodness, oh goodness. I'm definitely no lack of information, I can tell you that. This is one of my favorite slides because this is a poster-like indication of where CTE comes from. If you think about it, the repeat subconcussions, concussions, followed by the blood-brain barrier disruption. The molecules go into the brain. They attack the microglia. You start creating the antigens from the antibodies that are made from the antigens, and that's followed by neuroautoimmunity, neurodegeneration. That's CTE in a nutshell. And I'll throw it out there real quick if you haven't read it. My mission is to save as many brains as possible by changing the entire paradigm of concussion management globally. And that means all around the world and all around concussion management. I could get real intense with telling you guys how I treat concussions, and I'll just drop 3 simple statements. I use lifestyle, diet, and nutrition. Basically lifestyle, put them on some brain base, some exercise, some balance testing, get them some rest. Diet, remove inflammatory foods from their diet and try to find triggers that may be creating that upregulation of the inflammation. And nutrients, specific nutraceuticals that I utilize from Apex Energetics that help downregulate the inflammation, close the blood-brain barrier, and stop the immune attack against the brain from the body. And that is probably how I'm going to have to leave it, because I know you're coming down on some short time here, Lynn. So
yes, there's so there's a really good question in the
okay.
chat from Karen, and Karen asks, can my primary doctor order these blood tests? And this is important because I was going to raise this issue as well, because one of the things that we've often talked about is being able to have remote access, right? I mean, many people are all over the place that attend the webinars. So how could we potentially work with them? Because I know that what I had to do was swabs on my mouth for my cortisol and my other measurements, and I had to do urine tests. So can you kind of speak to the remote feature that you might be able to help people with?
Well, yes. Most doctors can order these tests. All you have to do is contact Cyrex Labs and become a provider with them to order the test. And basically, they mail you the kits. You draw the blood at your office, or you can send them to LabCorp to get the blood drawn, and then it can be mailed to Cyrex. So it's not hard to draw the blood or to get the testing. I do a lot of work remotely. A number of my patients. So as far as Amon Jordan, I mean, I've got a ton of patients out there because of one fellow who kept referring to me. So I can get this done mostly anywhere, and it's not limited just to a certain handful of doctors. Any doctors can actually get on board with Cyrex Labs. The downside is knowing what to do with the results when you get them, and that's that's where I get to speak all over the country to doctors to teach this stuff to them. And that's the kind of the fun part.
Awesome. So there's a couple other things that I wanted to also point out. And if anybody has a question, either jump on in, interrupt me, or put it in the chat if you would like me to read it. But remember, we discussed about Abbott, they came out with that blood test. I know it's not well received. It can only work within, I think, the first 12 hours. And it's for stroke patients as well as for patients that have had head impact injuries. So it's interesting to me because your blood tests, the IgA and the IgMs, are usually in that time span when people really start to notice something is wrong, right? The ER often misses more than 50% of the time, closer to 67% of the time, they miss those head injuries. And in my daughter's case, they missed not only the head injury, they missed her stroke. And so, it's really amazing when my daughter she did these endocrine tests and things like that. Hers were backwards, everybody. Hers were absolutely opposite of what the normal numbers are supposed to be on the patterns, and they were inverted. And so this is a chronic condition, and maybe you can speak to this also, Mike. It's not a quick fix, right? We really have to make sure we all understand that it's a combination of things. And I appreciate you talking about Sally and how the combination of being able to address symptoms can really help. And I also will say I have such a sweet tooth that when my doctor, functional neurology doctor, addressed my sweet tooth, because I have very low blood sugar, I stopped having to have the candy bar in the afternoon or the coffee. And it was just from the right adrenal support glands. So it's just amazing. In Natalie's case, she was doing 4.5-hour naps every day. And after about a week, she literally stopped napping. Like, I didn't think she could work. So maybe kind of talk about that, more real life examples for people to hang on to as well.
Oh, well, gosh, yes. The key is that in functional medicine, it's a for me anyway, it's a neurometabolic pathways. I'm looking for pathways and causation. So from the brain to the body back to the brain, it's a feedback loop system. So when there's a head injury, for instance, there's a brain gut axis interruption, which can also be a brain immune axis and a brain hormone or endocrine axis. Anything that's going on in your body, like your daughter with with hormonal issues, the endocrine system wasn't feeding back, cortisol levels were out of balance. That's brain. That's you can take all the supplementation and take all the medications and all the different things to support cortisol release from the adrenal gland, but it's not going to change a whole heck of a lot as far as functionality unless you address the brain. So certain adaptogens will help that hypothalamus pituitary adrenal axis work when the pump, the system that's making the cortisol isn't working. It's a feedback loop, and it has to be that way. That's the primary concerns that I find, especially when there's a brain injury. No matter how old it is, I have patients coming in completely chronic and just they're completely unraveled because this brain has been malfunctioning for some time because of neuroinflammatory events.
I need to take that thought to a very good question in the chat. Is it likely to expect lesions on the brain when someone has had a concussion undiagnosed?
I would, just off the cuff, I'd say yes, and that's what CTE is all about. If it's undiagnosed, untreated, it's not guaranteed because the brain has incredible healing abilities, but you've got a pretty good chance of developing some kind of lesions. And that white matter that's detectable on MRIs down the road oftentimes is referred to as a normal variant. There's nothing normal about that variant. Everybody's going to develop more and more different levels of disruption or degeneration.
Right.
But you can pretty much expect it if the blood-brain barrier has not been healed or closed and you've got neuroautoimmunity antibodies attacking those brain tissues over time, you're going to find evidence on an MRI.
And I think that speaks to, so if you recall, my My career was in clinical trials research, and our mission is to accelerate research for people in the brain injury space. And we know that the companies that are involved with Alzheimer's and Parkinson's research, Michael J. Fox's foundation is a big one, have now backed up all of their research participants to include people with brain injuries. And that is because there are high correlations to that very question that was asked.
Yep.
You are at risk. And, I hate to say this because it's a scary thing. And I fear for my daughters, both of my daughters with this. So, I'm on a mission, obviously, to get this fixed to help everybody. Is there a good protocol for dementia? Matt has asked.
Well, dementia is, I treat that very similarly to the brain injuries. Basically, like I said, once the injury has occurred, no matter what it is, dementia can come from a lot of different points of view. If the antibodies are measurable, I'm going to go after the immune system. I'm going to downregulate the immune system. I'm going to stop the inflammatory event. And depending on how progressed the dementia actually is going to pretty much relegate how much healing and how much recovery we can get from it. At best, I believe we can stop its progression. Maybe almost at best, we can start rewiring the brain with neuroplasticity to help improve that patient who's moving into dementia. It's always a big question for every single patient. They're all so different, but there are strategies that can address it. Absolutely.
We got a really good question. Great stuff, Dr. Alden. Thank you. It's interesting. The autism community research has indicated dysfunction with blood-brain barrier gut levels of IgA and IgG. It's off the charts with their testing. So yeah, I believe that. That doesn't surprise me either. I will say, I experiment on myself a lot. Like I try things before I bring them to our population here, our community. And when I stopped my own nutritional therapy, when I had the mold poisoning, I can assure everybody, I went downhill so fast. Now I have a lot to do, right? But when I just cannot believe, and in about let's say 2 weeks, right? It took that time for me to get back up to like, I'm not absolutely exhausted. I do not fortunately have a head injury, so I can't even imagine how that does honestly feel for people who have been injured in any way, shape, or form. I try to imagine it, but I can assure you there is a big difference. Mine was sickness, right? So, but still, there's something to be said. And I'm also of the belief, why not? We know there's things that are not going to hurt you. Why not at least know? Because the more you know about your panels or your tests, the better you become informed. And you can, again, do your tracking and figure out, is it making a difference?
Right.
So it is past. We're only 4 minutes past, not too bad. But everyone, this goes up on a replay, as you know, on Sally. So if you've not registered for your account on Sally, please do. I will also, if it's okay with you, Mike, I will send your contact out to everyone. And if they want to discuss having the lab work done with you, then, it's up to you guys. I will keep bringing you as many opportunities to improve your health as I can. And if there's any last thing you'd like to say, Dr. Alden?
Well, I appreciate you guys and this opportunity to share with you the things that I've been doing. Also, by all means, contact me, reach out to me. My email, I'm sure Lynn can share with you. If you hit me up on that, I'll be happy to attach a copy of that document, that research article that I was talking about earlier. And again, any interventions here that I can offer you guys, or information I can offer you, I'll be more than happy to share with you. And hopefully I'll get back out on the speakers trail pretty soon. It shut down during COVID, and Apex and Cyrex are bugging on me to get back out there. So hopefully I'll maybe see you guys at one of the conferences.
Well, let's get you at the March one. So great presentation from Jane. Hi, Jane. And yes, you will receive the PowerPoint. We're going to send all this. Is this okay? As long as it's okay, I'll send Dr.
Sure.
Alden's information to everybody. I will send the PowerPoint. You'll know when the replay is up. And as soon as you send me the research article, and then everybody will be connected.
Okay.
All right. And this is something too, and I'd like feedback. Feel free to shoot me an email or pop it in the chat right now. This is something that I think we would like to potentially bring to Sally. Just put a little button there. Do you want your labs done? And you can click it and then you can go. So try to make it even more seamless. So if you have any input about having these opportunities on Sally, because I don't sell ad space, and I'm very careful, as you all know, what should really go on Sally, because there's a lot of people that I don't think match our mission. So, but if this is something that you are interested in, I will listen to everybody and see what we can do. Hi, Keith. All right. Thank you, everybody. Joyce, you were not late, by the way. So this was great. And I appreciate everybody coming. I appreciate you, Dr. Alden. I'll see you in a couple of months. And again, reach out if anybody has any questions, okay? All right. Thank you. Bye, everybody.
Okay, thank you.
Thanks, Mike.